Okay, so good evening, everybody, and welcome to this session on idiopathic toe walking. Now, toe walking is something that we see a lot in the pediatric OPD. So this becomes quite an important topic, both from the theory as well as from a very, very practical point of view. Okay, I hope my screen is visible and I'm audible.
Yes, sir.
Yes. Okay. Okay, so about toe walking. So what exactly is toe walking? So as we all know that in the gait, we have a stance phase as well as a swing phase. Now, when we have the stance phase, the first thing that meets the ground is the heel. So we call that the heel strike. Now, toe walking is defined as a condition where the initial foot contact pattern in the stance phase is on the forefoot rather than the normal heel strike. So in a normal individual, what we would see is that the heel comes into contact first. Okay, so that's the heel strike. But in a patient who is suffering from toe walking, what we have is that the heel is off the ground and the forefoot comes into contact with the ground initially. Okay, so there is no heel strike as such. So that is what idiopathic or toe walking is. Now, why do we call it idiopathic? Okay, so we call it idiopathic because we do not really find a reason for this. But are there reasons why a child can walk with on the toes without a heel strike? So for that, we initially need to evaluate every child who comes to the outpatient department with this complaint and find out whether there is any cause or not. In case that there is no other organic cause for the toe walking, then it becomes a idiopathic toe walking. Whereas if we find out causes leading to this clinical feature of toe walking, then we would call it an toe walking due to a condition. That could be congenital, it could be acquired, it could be neurologic, it could be neuromuscular. So one of the most notorious, not notorious, one of the most common cause for toe walking abnormally seen in children would be spastic conditions like cerebral palsy. Whereas when we don't find any other organic causes where it's not congenital, doesn't look acquired, is it neurologic, then it is called a idiopathic toe walking. And in this idiopathic toe walking, it has been seen that a vast majority of children do suffer from some sort of a autistic spectrum disorder. Okay, so some form of autism, all the way from mild till a severe. Okay, so about 40 to 50% of the children with idiopathic toe walking do have some amount of autism. But does autism cause toe walking? It is not a direct cause as such. That is why we still call it idiopathic toe walking. Now, irrespective of whether it's an idiopathic toe walking or toe walking due to any other reason, the treatment would be more or less the same. Okay, so in the end, we come to the treatment. Okay, so what does the natural history tell us? Okay, that about 5 to 25% of the children suffer from idiopathic toe walking, and this is all the children, healthy, unhealthy, all of them. Okay, out of which, do we know how many cases resolved spontaneously? So the only study which has been done on a large cohort, which was done in Sweden, found out that out of 1,500 odd children who were examined or who were present in the cohort, only about 75 children had toe walking or had ever complained of toe walking. Okay, this is at 3 years of age. When the same cohort was followed till 5 years of age, that almost reduced to less than 40%. So how many children were walking? So about 70% of 70 children were walking with toe walking. That reduced down to 30. And by the time they were 8 years old, that reduced even further to about 25. And then by the time they were 10 years of age, hardly about 15 children did suffer from toe walking. So out of 1,500, 15 children would be less than around 1% or even less than 1% who would be a persistent toe walk. Okay. So does genetics play a role? We have seen that a large majority of these children are males. So it is thought that it could be a autosomal recessive condition, which is not manifested in the it is not manifested in autosomal X-linked recessive condition, which is not manifested in the female population. It is only manifested in the male population, and there has been a family history which is seen in these patients. So how do we diagnose? Okay, so lack of heel strike during the stance phase will call it toe walking. Okay, but the initial workup of the child should include a thorough history and a thorough physical examination, looking at even the general development, when the toe walking started, whether it's progressing or not, whether it's present at some parts of the day and it gets worse throughout as the child walks, or is it worsening over time. Why are all of these important? Because all of these are causes or other reasons why a child could walk on his or her toes. And these are all those other diagnoses which